everybody, it's Dr. Paula Kowalski with Kowalski Chiropractic. So I am 33 weeks pregnant this week and I am getting ready for a treatment myself from my husband, Dr. Tyler. So I just kind of wanted to show you chiropractic is completely safe through all stages of pregnancy. It's super beneficial. And we just kind of wanted to show you what an example looks like with how the table can kind of modify to adjust for the belly, and then kind of what a treatment looks like for a pregnant patient. So we both have a couple different tables, but they both have similar things that they can do. So this pelvic piece comes up here, which allows room for the belly in through here, and then this abdominal piece drops down a little bit. So that kind of caves in a little bit and makes room for the belly as well. We also have a pillow that we can use. So this pillow has a little bit of a cutout for it in the center here for the belly. So I'm just gonna put that, go this way, just like that. And then I'm gonna go ahead and lay down on the table, and then he's gonna get to treat me and kind of explaining different stuff that we can do. So.
Hi, it's Dr. Tyler Kowalski. Now that Dr. Paul is laying face down, all comfortable on the table here, we're going to show you what kind of a third trimester patient would go through during one of our treatments here. So, first thing we're going to do is just make sure the low back and pelvis is all lined up and moving good. We want to take all the tension out of here, make sure all the joints are moving well here. So we kind of check her out here. What we're looking for is kind of a nice spongy feel when those joints are moving good. If it's really restricted, kind of like a brick wall, that kind of lets me know that the pelvis and those joints there are really locked up. And so if we want to be real gentle, we have this adjusting tool that we're just going to run over the joints that are a little restricted here. She's just feeling just kind of a gentle little thump, just gently loosening up the joints in the low back here. Work our way up into the lumbar spine here, a few spots up in here. So all this is real gentle on the spine, safe for the baby. Good there. And with that belly growing and have a lot of tension pulling on the low back and the mid back, there's always usually a few common spots that get really restricted and locked up in here. And then we're going to do actually a couple spots right through the thoracic spine, kind of mid-back area here that are a little locked up, just more kind of a regular chiropractic adjustment here. We'll have her take one deep breath in and out. Good. And one more spot right here. Good there. So that kind of shows you just a gentle way we can adjust the third trimester patient. We'll have her kind of flip over onto her back, and we'll do a few more things then. On her back here, we're going to adjust her neck, and then we're going to kind of check out her belly and hips and everything, make sure we get all that loosened up as well. So there's 7 different bones in the neck that we're checking out, just kind of seeing how they're moving side to side and then rotating as well. A couple little restrictions I'm feeling here. Do one on this left side here. Good. And one more on this right side here. Good. So we got the back and the neck all moving well, and then we're going to check kind of all the tension kind of in the hips here. So the first thing we're going to check is kind of the hip flexor muscles. One quick check we can do just to see if one side is tighter than the other is to have her bring both arms up and then kind of bring them back. I just add a little tension here, and then depending on which hand is a little bit shorter, that's going to tell me which hip flexor might have a little more tension in it. So I kind of put the fingers together, and this hand right here on the right is a little bit shorter than the left side, so that's going to tell me that the right hip flexor is a little tighter. So we're going to get that loosened up here. So there's a couple different ways we can stretch it. We can either put her on her side, or an easy way is to just kind of keep her on her back, grab this muscle and kind of go in a little circle here, and just gently stretch out this hip flexor here. Should be real gentle, nice and easy, just getting some of that tension out of there. Do a few passes, and then we'll recheck her. Good, and the hands are all lined up, fingers are perfect there. So the next thing we're gonna do is check out the belly here. And there's a couple things when we're evaluating that. Kind of on the top side, we're going to kind of clear all of the diaphragm area, make sure all the tension's out of here. If there's a lot of tension through here, that can cause some reflux, some heartburn, some digestive problems up through here. And so we want to feel around here if there's any tension or tightness kind of right underneath the rib cage. Just kind of gently get in here and stretch it out. As I'm pulling down, I might have her take a couple deep belly breaths in and out. Good. And just really gently, just kind of stretching all this out up on the top of the belly here. Good there. And we kind of clear all that tension out of there, make sure that's feeling good, which it does there. And then the other part we're going to check out is the round ligament. So if you draw a line from your belly button to the front of each pelvis bone right on the front here, that's kind of where that round ligament runs right through there. And if this is really tight, that can cause some tension or pain kind of in the lower stomach or belly there, all the way out even into the front of the hip there. So this left side feels just a little more tension, a little more tight on that side. So I might have her bring both knees up just like this. And I just kind of, same thing, just kind of a gentle pressure. I'm kind of pushing in and up towards the belly button on this ligament side. Hold it 10-15 seconds till you feel it release a little bit. And then I'd feel kind of all along the bottom of the belly there, with all that weight kind of pushing on there. All those muscles and ligaments can get really tight through here. So we just want to clear that up, balance the pelvis and the belly, just take all that tension out of there to help with any pain, or just kind of get your body feeling better and getting all that tension out of there. With this stretch, you usually feel the baby's kicking quite a bit or moving around, which it is doing right now. All right. And I think that'll be good. Definitely the right side had a little more tension today, so we kind of cleared the neck, the back, the hips, and then the belly there, getting all that moving well and feeling good. So there's an example of a treatment for a third trimester patient. Really safe, gentle, and just helping you feel good through your pregnancy there.